Good morning. I would like at first to congratulate the organized committee for this high-level course. So the topic today is for shoulder arthritis, and we must know that each year millions of people are affected with some kind of arthritis, and the shoulder is the third most common joint after hip and knee, and this is probably because it's not a weight-bearing joint as hip and knee. It can affect glenohumeral and or AC joint. In definition, when the cartilage in the shoulder begins to break down on the surface and eventually in the deeper layers, this is called shoulder arthritis. It can affect humeral head or glenoid or both, and usually results from graduate wear and tear on the cartilage, on the surface or the cartilage at first. The cartilage is about 2 to 3 millimeters thick, and if the cartilage is intact, it can take multiple rotation with no wear on the surface because it's very smooth. So arthritis develops in stages, and at first the cartilage gets soft, and then it develops cracks in the surface, and then it begins to fibrillate, and at the last stage, at the end stage, it wears away to expose the bone, the underlying bone. The symptoms may vary from a person to person, depending on the level of activity, the age, and the stage of the arthritis. Pain is the most common symptom, pain in the shoulder joint, and then we have, after pain, we have later stiffness and the loss of range of motion, and maybe grinding, clicking, or cracking inside the joint, the noises that the patient hears, and eventually we have some kind of disability. Most common type of arthritis is primary osteoarthritis. It is a degenerative disease which is related to age and a wear and tear type of arthritis, and probably it's a combination of overuse, maybe genetics or microtrauma in the past, and increased force in the joint. Then we have secondary types of arthritis. As inflammatory diseases, rheumatoid arthritis is the most common. It's an autoimmune disorder who can attack multiple joints and affects also the surrounding soft tissues. Usually we have central glenoid wear and medialization of the humeral head. Another type of secondary arthritis can develop after fracture, dislocation, or severe trauma and injury in the shoulder area. And this damage can cause the cartilage to wear out and eventually disappear. Also, if we have massive and prolonged calf tears that are left untreated, this is called rotator cuff tear arthropathy and can lead also to arthritis. The damage to both soft tissue support of the joint and the joint surface leads to this kind of arthritis. And later on, because there is no soft tissue roof, we have migration, cranial proximal migration of the humeral head, and development of arthritis. Another type is osteonecrosis or avascular necrosis, which is a rare type, an unusual condition, in which the blood supply, the humeral head is interrupted. This leads to the death and eventually collapse of a segment of the bone, and the cartilage break down due to the lack of bone support. And the causes are high doses of steroids, or alcohol consumption, or sickle cell disease, and traumatic injury in the past. So we have also another type of secondary arthritis, which is called post-surgery arthritis, and this is a complication, let's say, after open reduction internal fixation of a humeral head fracture, when you have screw penetration or avascular necrosis. And another type is when we have over-tightening of the soft tissue in stabilization surgeries. This forces the humeral head in one direction and causes head to wear unevenly on the glenoid. And last, we have chondrolysis following arthroscopy, which is a pathophysiology unknown, which leads to the dissolution of the articular cartilage. The risk factor for developing arthritis as shoulder joint injury, fracture, dislocations, or other serious trauma can lead to cartilage damage. Also joint stress and overuse. People whose activities and jobs require spending a lot of time lifting heavy objects and overhead activities, or throwing, or doing high impact activities. We also know that arthritis advances with age, most commonly affect people over the age of 50 or 60. And arthritis can develop in other conditions also, as septic arthritis and other metabolic disorders. And we know that arthritis is more common also in women than in men. After clinical evaluation and the medical history, the history of trauma maybe, X-rays are usually enough to confirm the diagnosis in mid to later stages, but not in early stages. So what we see in X-rays is joint space narrowing, development of osteophytes, subchondral systems and sclerosis, humeral head migration. You have cavity-area arthropathy, glenoid wear, and maybe you have also AC joint arthritis. MRI in general is crucial to evaluate the pathology of rotator cuff and the soft tissue, but it's less accurate than CT scan in distinguishing the glenoid types and the erosion of the glenoid. So to complete the whole image, maybe sometimes we need to have a CT scan also to evaluate the morphology of the humeral head and the glenoid, the version, the erosion, and the bone stock. And we also need the CT scan if you want to have a preoperative planning. 3D reconstruction is also needed sometimes in order to give us the whole picture in 3 dimensions. So, in conclusion, we'll say that arthritis has 2 types, primary osteoarthritis and secondary arthritis. It develops in stages. The symptoms may vary from person to person. We must always suspect some kind of arthritis with medical history of serious trauma, and imaging with X-rays, MRI, and CT complete the whole picture. Thank you for your attention.